our show, Health and Wellness, Myths and Facts. Now, hormones affect everything from blood sugar to blood pressure, growth, fertility, sex drive, metabolism, and even sleep. Their influence goes as far as changing the way we think and act on a day-to-day basis. So there's no doubt that hormones are powerful. One such hormone is insulin. Now, insulin is a key factor in the development of diabetes. Insulin is a hormone produced by the pancreas that has a number of important functions in the human body, particularly in the control of blood glucose levels and preventing hyperglycemia. Now, insulin also has an effect on several other areas of the body, including the synthesis of lipids and regulation of enzymatic activity. There is no doubt that many of you are aware of diabetes, but few are aware of the role insulin plays in the management as well as the prevention of diabetes. Now, according to a report, globally about 9 million people with type 1 diabetes rely on insulin for survival, and about 63 million individuals with type 2 diabetes require insulin for treatment. Now, although the discovery of insulin in 1921 absolutely revolutionized the treatment of diabetes, inadequate access to insulin and diabetes care remains a problem in many countries a century later. Insulin usage and its role in diabetes management are surrounded by various myths. There are eminent endocrinologists with us today that can help you better understand how insulin plays a role in diabetes management. Joining on the broadcast, Dr. Akash Shah, consultant endocrinologist at the Sushruth Hospital from Ahmedabad. We also have Dr. Kanhaiya Agrawal with us. He's an ex-senior resident of endocrinology at CMC Vellore, also an ex-lecturer at BRDMC, Hormone and Diabetes Care in Gorakhpur. Dr. Rakesh Arora also on the broadcast with us. He's a consultant endocrinologist at the Government Medical College in Punjab's Amritsar. Dr. Shah, I'd like to begin with you. Now, it's well known that insulin regulates the glucose level in our bloodstream. But how does insulin work in the body? Do we become more resistant to insulin as we age?
Right. So I would like to explain it in a bit simplified way to our audience. Our body is made up of the cells. Cells are the basic building blocks. What insulin does is it opens up the doors of the rooms. So the cells are kind of rooms and which has got doors. Insulin acts on the cells so that doors are opened up, and now glucose makes entry inside the cell, and insulin also facilitates the cells so that this glucose can be utilized. Ultimately, basic effect and more potent effect is seen on the liver, muscles and fat cells, so that this glucose is utilized and ultimately levels are maintained.
Dr. Agrawal, now diabetes is a growing health problem in India. Is this due to insulin resistance, and are Indians more prone to insulin resistance?
Yes, well said. Actually, we know that we are the second largest in the world to have the diabetes after the China. And with the pace we are getting the numbers, we will be top the list in 2045. So due to the various things like poor lifestyle, eating junk foods, canned food items, overweight or obesity, or more carbohydrate intake in our country, they all lead to the more insulin resistance. Let's other things like family history of diabetes and ethnicity, like we have the more visceral fat, that means the fats around the organs. All these things leading to the prone to have the insulin resistance. So with all these factors, Indians are more prone to have the insulin resistance, and we are having the more number of diabetic also.
There is a strong evidence that Indians have higher levels of insulin resistance and a stronger genetic predisposition to diabetes, as Dr. Agrawal has made it clear for you. With that, let's also rope in Dr. Rakesh Arora. Now, doctor, pre-diabetes is an opportunity to prevent diabetes. Can insulin therapy help in treating pre-diabetes?
Yes, you're very right that pre-diabetes is an opportunity to prevent diabetes mellitus, but insulin is not the right choice as a preventive measure because pre-diabetes is a risk state that denotes the blood glucose values in between normal and frank diabetes. It's not a disease entity. So basically, it means that people with pre-diabetes are at increased risk of developing diabetes mellitus than normal persons, but progression to diabetes mellitus is not inevitable. So the first and foremost mode of intervention in such people is lifestyle intervention. It comprises two major components. One is the medical nutrition therapy, which is basically the dietary modification. So such persons are advised to take small frequent meals. They are advised to consume more vegetables and fruits with low glycemic indices. They are advised to consume foods rich in fibers. They are advised to avoid direct sugars like sweetened beverages. they are advised to avoid foods rich in saturated fat and cholesterol. The second major component is physical activity. So they are advised to have an active lifestyle. They are advised to have an exercise schedule with moderate intensity exercises, for example, a brisk walk, for at least 30 to 45 minutes per day, for at least 5 days in a week. And on top of that, they can also go for resistance training. So in people with pre-diabetes with blood glucose values bordering the cutoff for diagnosis of diabetes mellitus, we may sometimes give oral medications that belong to the category of insulin sensitizing, for example, metformin, that enhance the action of body's own insulin. But insulin therapy from outside is not recommended as of now.
Right. Dr. Akasha, it's also a common myth that insulin can cause dangerously low blood sugar levels. Is it true, and what can be done to manage such conditions?
Well, it is a common concern that we come across in our patients, and till some extent it is a genuine query, a genuine concern by our patients. So I would like to explain it first in a simplified way. Consider your body as a vehicle, and whatever glucose is there is a fuel. So whatever you eat ultimately gets converted into glucose, that is the fuel, and insulin is kind of an accelerator. When you push the pedal, when you accelerate it, when you use the insulin, your glucose gets utilized. So there has to be a balance that should be maintained between the fuel and the acceleration. That is, if you take too much of food, too much of glucose intake, that leads to elevation in blood glucose, that is your sugar getting out of control. Or else, if you accelerate too much, that is if you take excess doses of insulin, or if you take unbalanced dose as compared to the food intake, if you take less insulin, more insulin, ultimately you will end up in hypoglycemia. So first and foremost, to avoid any hypoglycemia, you should maintain a balance, and usually your doctors, your care providers carefully advise you a dose so that you don't end up in hypoglycemia. However, if at all you face any troubles, that is sugar going down, you may experience certain symptoms like tremors in your hands, excessive perspiration, sweating, and palpitations. In those scenarios, you should immediately check your blood sugar level. If it is found to be below 70 milligram per deciliter, you should take 3 teaspoonful of sugar with water, and you should repeat checking every 15 minutes until your sugar record is more than 100. And afterwards, you need to consume small amount of snacks which contains some roti rice mixed with dal or sabzi. And afterwards, if required, you may need to reduce the dose of insulin as per your body requirement.
Right. Now it's clear that insulin is responsible for reducing blood glucose levels in the body when it's too high. Dr. Agrawal, when is the best time to take an insulin injection?
Yes. So that depends mainly upon the type of insulin. Like in the patient for type 1 diabetes, we used to give the 4 times insulin, mainly the basal and bolus regimen, what we say. While in the type 2 diabetes, which commonly see in our practice, where we need to start the insulin, then we start usually the longer acting insulin. And that insulin having the duration of action at least for 20 to 24 hours, sometimes few insulin having the longer action duration up to 48 hours. So that we usually give at the bedtime, or we say at the fixed time, that is around 9 to 10 p.m. But that is depends upon the individuals to individual. Sometimes we need to give in the twice daily dose also. While those insulin, those are the shorter acting insulin, like we have the regular insulin, or we have the analogs in the form of Aspart or Lispro. So this insulin usually control the post meal glucose level. So this action starts after the 5 to 30 minutes of the administration of the insulin, and that can take care of the post meal glucose level. So this is depend, and that has to be given at least 5 to 30 minutes prior to meal. So depending upon the insulin, like regular insulin, which we usually give 30 minutes prior to our meal, or analogs like Aspart or Lispro, which we usually give around 5 minutes prior to insulin. So overall, everything has to be decided by your clinician or physician, by your doctor, that what is the best time to take insulin and which are the insulin need to be taken. So do not try yourself, or do not make yourself a decision for the starting insulin. Thank you.
Right. Dr. Arora, is it true that wherever on your body you inject insulin, it affects your blood glucose levels, and why?
Yeah, it's absolutely true that the site of insulin injection, it plays a significant role in how the insulin will bring down the blood glucose. So basically, insulin is supposed to be injected into subcutaneous fat tissue. that is present just below the skin. When insulin is injected into this subcutaneous fat tissue, the insulin molecules, they aggregate amongst themselves, and then they are slowly released from this aggregate of insulin molecules over a period of time into the blood circulation. So if insulin is injected at a site where the subcutaneous fat is less, it may get injected into the muscles, and the absorption of insulin may be very rapid, and it may bring down the blood glucose very rapidly, leading to what we call as hyperglycemia, which can even be fatal. So insulin needs to be injected at proper sites. The recommended sites are first abdomen, which is the most commonly used site, at around 4 fingers breadth away from the belly button, or 2 inches away from the belly button on each side. Then it can be injected on the outer and upper aspects of the thighs, which is again very easy for self-injection. The other recommended sites are upper and outer aspects of the buttocks, but it is not easy for self-injection. Then it can be injected on the upper arm. Again, it may be difficult to inject by yourself, especially when you are using your wrong hand. Patients should also avoid injecting on the moles or scars or areas around the belly button. And finally, they should try to rotate their injection site, because insulin, if it is injected repeatedly over the same site, it leads to accumulation of the subcutaneous fat, which leads to even further delay in the absorption, and it can hamper the efficacy of the injected insulin.
We're stopping for a short break, doctors. Our experts, though, stay on with us to answer all your queries regarding how insulin plays a role in diabetes management. Our experts from across the country are here to answer all your queries regarding how insulin plays a role in diabetes management. Now, Dr. Shah, people with diabetes have comorbid conditions and take several medications. Can you take insulin together with other medicines as well?
Right. Now, majority of our diabetic patients, as the duration of diabetes progresses, as the duration goes beyond 5 years or 10 years, they tend to have lot many other comorbidities. This include their hypertension, this include their cardiovascular status, that is heart attack issues, etc. So majority of our patients are on multiple medications, and they have got this question, this doubt whether it is safe to take insulin along with other medications. Now, for majority of the other medications, there is no major concern, no as such adverse event seen. That is, insulin is safe to be administered with other drugs. However, when we are talking about medications for glucose control, now many of our patients are taking insulin as well as tablets for diabetes control. And when patient is getting this multiple tablets as well as insulin, there is still a chance of sugar going down, that is hypoglycemia. Hence, you should not play with the doses of the medication or insulin by yourself. It has to be monitored, observed by your care provider, and as per the advices, you should adjust the doses so that you get the best possible control. Otherwise, there is nothing to be worried about.
Right. So insulin does not interact with other medicines. In that case, it's safe to be administered with other drugs, as Dr. Shah has just asserted. With that, let's go across to Dr. Agrawal. Doctor, what role does a healthy lifestyle play when you're on insulin therapy?
See, like a healthy lifestyle, it doesn't mean that we have to go for only activity. It includes everything, our behavior also. So like from our diet pattern, as we discussed, that we have to avoid the junk food items or canned food items or cold drinks or many more things, like we all know about the bad food items. Apart from that, physical activity, as Dr. Arora said, that 30 minutes walking per day at least for 5 times in a week. That is very important to maintain our insulin sensitivity. That means reduces the insulin resistance. So in spite of controlling the blood glucose level with this physical activity or healthy lifestyle, it having the helps on the various other parameters. Like it reduces the dose of insulin requirements. So those patients usually go for this physical activity like walking or exercise. The requirement of insulin is less as compared to those who do not walk. Apart from these things, we are having also good effect over the blood pressure, reduces the blood pressure. Healthy lifestyle also reduces your weight, improves your metabolic parameters like lipid profile, reduces the fatty liver conditions, and also improves your heart conditions. So your heart also becomes very healthy with these all healthy lifestyle interventions. So I would think that we all should go for the daily walking for at least 30 minutes per day, and I believe that daily walking is better than 5 times a week.
Now, there are some reports about the development of an artificial pancreas. Dr. Rakesh Arora, can these help cure diabetes? And if you could break down for us, what is an artificial pancreas? How promising is this new advance? And is it available in India yet?
Basically, artificial pancreas is a closed-loop system of devices that tries to mimic the function of a normal human pancreas. It's used for patients with type 1 diabetes mellitus who totally lack insulin production. So they are dependent upon insulin given from outside. Normally, they are given insulin in the form of injections, either 2 or 3 or 4 injections per day, or as standalone subcutaneous insulin infusion pumps. And then these patients need to perform frequent self-monitoring of blood glucose to decide upon the dose of insulin that needs to be injected. Artificial pancreas has 3 major components. First is the continuous glucose monitor, which is a small needle which is inserted just below the skin, which tracks the body's glucose every few minutes. And then it sends the data to the next component, which is the program or the software, which can be either in a smartphone or in the insulin infusion pump, which is the third component. So the function of this program is to calculate the insulin dose that is required for the body as per the current glucose values. And third component is the insulin infusion pump, which receives this data from the program and it delivers the dose of insulin as calculated by this program. So it's a very promising approach, but it's not a cure. We cannot call it a cure because patients will require some form of insulin during the rest of their life. However, it has several advantages, like it's more automated. It does not require frequent inputs from the patient. The patient is free from multiple tricks, from self-monitoring and insulin injections. The patient's glucose reading can be tracked by a doctor or a parent or a guardian who is sitting remotely somewhere else. And some artificial pancreas, they also have an insulin suspend function. So whenever the blood glucose levels, they go dangerously low, the insulin delivery is suspended, and thus these patients are protected from hyperglycemia. So it's a very promising approach, but in India it's still at a nascent stage. I think there's only one report of a patient being put on artificial pancreas in 2021, and still it is not commercially available in India.
Right, lots to unpack there. Thank you so much for the clarity on the matter. Also, Dr. Shah, does injecting insulin into the stomach cause additional fat to accumulate there?
So, Dr. Arora a while ago has nicely explained how it works when you inject it. It goes inside the fat at the level of the stomach. There are 2 different components, 2 different effects. One is overall insulin leads to increase in appetite, increase in hunger, and also whatever is being eaten gets deposited in a better manner. So ultimately the person is likely to gain some weight, and that is how we can explain there has to be some weight gain and some increase in stomach fat. Another thing, when the person fails to rotate the site properly, that is, if the insulin is being injected at the same site multiple times, it is more likely to lead to local increase, that is a small area of fat getting increased. And this happens because insulin, apart from its overall effect via getting circulated in the blood, it also has effect on the site where we are injecting it. So when it gets deposited at the same site multiple times, it leads to a small lump like area, small swelling like area, which is just nothing but the fat. So we always explain to our patients about how to rotate the site so that insulin works in the best way, and this kind of fat deposition, the localized swelling, can be avoided. And yes, as I explained previously, the weight gain and it leading to the increase in overall abdominal fat, that can be prevented by ongoing continuous activity, exercise, and maintaining a proper food and insulin balance.
Dr. Agrawal, what is the difference between short-term and long-term insulin?
Yes. So like a short-term insulin, it means the short-acting or long-acting insulin actually. So short-acting insulin is the action of insulin which starts 5 minutes or 50 minutes or 30 minutes after the insulin administration, or last action for around 4 to 6 hours. The duration of action is around 4 to 6 hours. So we are having two categories in this, the body short acting and we have the ultra short acting again. So ultra short acting is the analog type which has been genetically modified more. So like we have the short acting, that is the regular insulin, that is like commonly used and bit cheaper. So it is usually given 30 minutes prior to meal because its action starts 30 minutes after the administration, and duration of action of this insulin is around 6 to 8 hours depending upon the individual. So individuals have different variability. Secondly, about ultra short acting that I discussed about that earlier, the Aspart or Lispro. So its action usually start like 5 minutes after the administration. So and duration of action is around 4 hours to 6 hours. So this like again have to give in 5 minutes prior to meal. Sometimes in we have also like even faster acting Aspart is there. So in that we sometimes prefer also to give even post meal also, because the risk of the hyperglycemia, or in children those who cannot take the like appropriate amount of the food before after the insulin. So to risk avoiding the risk of hyperglycemia. Secondly, if we have the longer acting insulin, we have that again two categories. We have the like one is the like NPH insulin is there, that is the action, we have duration of action for almost 12 hours, and we have the another is the glargine, we have the duration of action around 18 to 24 hours, and the various modified form is also there. We have the Degludec, the ultra long acting, the duration of action is almost 44 hours. So depending upon the type of insulin and depending upon the, our patient's profile, we choose the insulin. Like in type 1 diabetes, we used to give the 3 times short acting insulin and 1 time long acting insulin. In type 2 diabetes, when we start the insulin as an initiation therapy, as a like add-on therapy to the oral drug, so in that condition we used to give the longer acting insulin that as a bedtime. So these are the difference between the shorter acting and longer acting insulin. Thank you.
Right. Thank you so much, doctors, for joining us with all that advice. We hope these experts were able to bust all your myths regarding the role insulin plays in managing diabetes. Thank you for investing your time and watching. Goodbye.